You put in months of strict diets and exhausting workouts. You lose the weight, but then, despite your best efforts, the scale creeps up again. It feels like a relentless, unwinnable push where the heavy boulder eventually rolls right back down the hill. For decades, society has told us this cycle happens because of a lack of discipline. We are told that keeping weight off is simply a matter of having enough willpower. Medical science has proven that narrative completely wrong. Obesity is a complex, chronic, biological disease. Because it is a medical condition driven by biology, treating it with guilt and sheer effort alone is the wrong tool for the job. This animated diagram shows what scientists call a biological set point. Your brain has a specific weight it wants to maintain. It works exactly like a thermostat in your house. If the room gets too cold, the heat kicks on to maintain the temperature. When you start eating less to lose weight, your brain does not see a healthy lifestyle change. It senses starvation. Instantly, it triggers a defense mechanism, flooding your body with survival signals that fight to keep your weight exactly where it is. These signals launch a two-pronged counterattack. First, they drastically increase your sensation of hunger. Second, they actively slow down your metabolism, causing your body to burn fewer calories to conserve energy. How does that thermostat get set too high in the first place? It is driven by invisible factors building up over time: your genetics, chronic stress, poor sleep, your environment, and even certain medications. When the weight returns, your discipline hasn't failed. Your body has successfully executed its evolutionary programming to protect its original set point. While your body thinks it is protecting you, carrying that extra tissue over a long period poses severe, quiet dangers. The excess weight puts immense pressure on your entire system. Over time, this constant strain forces your organs to work harder, leading directly to type 2 diabetes, high blood pressure, and heart disease. The physical structure of your body suffers too. Daily life becomes harder due to joint pain, obstructed breathing while you sleep, and a steady loss of mobility. Treating obesity has nothing to do with meeting societal beauty standards. The true goal is to relieve the dangerous pressure on your vital organs and allow you to move through your day without pain. Since we are fighting a deeply rooted biological thermostat, willpower is not enough. We need a much more comprehensive, lifelong toolkit. The first tool is what we put on our plates. A balanced diet of nutrient-dense foods gives your body what it needs. Eating plenty of protein is crucial here. It helps you maintain healthy muscle mass while you lose weight. Movement is the second tool. A minimum of 30 minutes of physical activity every day protects your heart and helps keep the weight from returning. However, changing how you eat and move usually results in losing about 5 to 7% of your total body weight. It is an incredible achievement, but on its own, it rarely resets the brain's thermostat permanently. These lifestyle habits are the absolute non-negotiable foundation of your health, but they are just the first step in a broader medical strategy designed to outsmart your biology. When someone has asthma, we give them an inhaler. When they have high blood pressure, we prescribe medication. Using modern medical tools to treat obesity is exactly the same, a necessary, logical step completely free of shame. Today, new medications can help by changing the way the brain processes hunger. They target the pathways that control your appetite, which helps quiet those constant survival signals and allows the body to lower its internal thermostat. For more severe cases, weight loss surgery is the most effective option. By physically changing the digestive system, these procedures create a permanent shift in the signals the body sends to the brain, effectively resetting the weight thermostat. None of these tools work entirely on their own. You need a village. Long-term success requires the ongoing support of healthcare providers, dietitians, and a community of friends who understand the journey. By understanding that your body has been following a biological script, you can stop blaming yourself. When you build a strong support system and use the right medical tools, you can rewrite that script and reclaim your health for good.